If you've been struggling to get a COVID-19 vaccine appointment, you might be puzzled by the numbers of people who say they don't want to be vaccinated. These vaccine resistors are spread across age groups, professions, and communities. Why are some embracing the vaccines while others shy away? What are the implications for ending the pandemic? Today, EdCast reports on the Convince USA initiative at the CUNY School of Public Health. It is a global project meant to promote confidence in COVID-19 vaccines. We'll look at how the City University is reaching out to those who don't want to take the vaccines. What do we all need to know to be convinced of their value and safety? Join us for this important conversation now on EdCast. My guest today is Dr. Scott Ratzan, Executive Director and co-founder of Convince USA. He is a distinguished lecturer at the CUNY Graduate School of Public Health. He is also the editor-in-chief of the Journal of Health Communication, International Perspectives. Thank you so much for joining us today, Dr. Ratzan. This is such an important topic. Any newspaper you pick up, I just saw an article from the New Yorker just before we started taping, that so many adults say that they don't want the COVID vaccine. They're thinking about it, they're undecided. It seems to be spread across many different segments of the population, Republicans, young people, minority groups. Our CUNY colleagues say that our students are reluctant to get the vaccine, which has big implications for the university. So I know that you've been involved in a major global project called Convince, and I'd love for you to tell us a little bit about it, what the goals of that project are.
Well, thank you, Linda, for the opportunity to be here today. We are trying to address the most important issue of our time right now, of this pandemic. How do we get out of the pandemic? And we know that the only way to get out of it right now, what science has given us, is the opportunity to get a vaccine. That getting a vaccine does not mean getting vaccinated. So what we've set out to do at CUNY School of Public Health is develop a project that we call Convince, which is an acronym for COVID, New Vaccine, Information, Communication, and Engagement. So we know that just giving information is not enough. Communicating with these kind of dialogues and opportunities are, of course, important, that we understand why vaccines are important. But yet finally, how do we engage with the public and our community? So that's what we're attempting to do. We know we need to do this with a strong science and evidence base, which is the basis of of course, our education and what we stand for at CUNY, but our also mission in terms of social equity and justice, and that everyone should have access to the vaccine and everyone should be able to get that in a fair and speedy way. And that's what we're hoping to do, both in the course of now in March 2021, a year into the epidemic, but also we've been tracking surveys and all sorts of pieces to help understand why people are either reluctant or what they're really even thinking at the time, so we can best address their concerns.
Let's talk a little bit then about what you have found out. So there are two things going on here: reluctance and access. Let's start with reluctance. What are the reasons that you've been finding out that people are reluctant to take the vaccine?
Well, and Linda, this is not a new phenomenon. In 2019, the World Health Organization called vaccine hesitancy one of the top 10 threats to humankind, as high as really climate change and others. Now, there may be some great proportions, but the reality in 2019 is we already started to see a drop off in measles vaccination. And you may recall in Brooklyn and other places, we had 20 some odd children hospitalized because they hadn't got a measles vaccine, which shouldn't happen. We almost got rid of measles in the entire Americas and this side of the world. And we saw the drop off because people were hesitant. So what happened when COVID hit is that same sort of hesitancy is translated into people's what you call reluctance or skepticism. Do I need a vaccine? Oh, is COVID real? Am I going to be fine with it anyway? And you may have heard, or people on the show may have heard, oh, I didn't get a chickenpox vaccine when I was a kid and I did fine. Why do I need to give my kid a chickenpox vaccine now? Well, we know that in the case of chickenpox, 400 kids a year died because of chickenpox. So the vaccine has prevented that. We know that vaccines prevent disease. We need to translate into vaccinations in people's arms. And we have a whole issue here with vaccine hesitancy and reluctance, as you've mentioned.
Now, for COVID-19 in particular, I know I hear some things from my students. They say they're not sure. They think it was done too quickly. They don't trust it. What are some of the issues that you've been hearing, particularly about this vaccine?
I think what you've said is very similar to what people, your students, are saying. If it's too fast, and we wasn't helped by President Trump or former President Trump's calling this Operation Warp Speed.
Right.
Well, warp speed is science fiction. We are lucky and fortunate, and the fact that science was able to go about this in a scientific way to actually get a vaccine to market with these new mRNA and other vaccines that are out there. So that's a positive thing. I think we need people to know that we have trustworthy regulatory authorities in science and medicine that has approved the vaccine, that has gone through thousands and now hundreds of thousands and now millions of people who have taken it. So we should get off of the suggestion that people were guinea pigs. Nobody's a guinea pig, because right now we know the vaccine's working. So I think the trust issue, the speed issue is certainly there. And frankly, it hasn't been helped by the conspiracy theory folks, the QAnons, and frankly, the social media, that what I call cyber-gated communities of people that are vaccine refusers or don't think vaccines are good, talking about everything from this is Bill Gates' idea to put a chip in everybody, or that this is going to sterilize people. Those are not true. That is misinformation, and we need to debunk those myths and those falsehoods as soon as possible. And I think these kind of shows that you have this discussion is really what we have in mind.
I think it was interesting that former President Trump did get vaccinated, but did not make a very big public display of it. So I don't even know how many of his followers know that he even was vaccinated. I just found out about it recently, and he'd done that in January. So I thought that was interesting. So let's talk a little bit more then about minority communities and the hesitancy that we've seen there. So I know you did a town hall. So tell us a little bit about that, and tell us what we know about minorities and getting vaccinated.
Sure. So at CUNY School of Public Health, since last March, now a year, we've been running tracking surveys of asking people, one, if they know anybody who's been sick with COVID, if they think COVID's real, if they'd be willing to take a vaccine if it were available. So about last summer, we found that only 54% of New Yorkers would want to take a vaccine if it were available and proven safe and effective. Now, that could be a variety of reasons. Maybe they thought it was going to be too fast, or they thought COVID would go away. But we kept tracking that. And what we found when it was 54% of all of New Yorkers, African-American communities were about in the 30% range. And this became consistent across the whole country with Kaiser Family Foundation polls, Pew polls, and so forth. So we looked very specifically at Harlem recently and wanted to see, is this still the case? And actually, we were quite pleased that it no longer was 30, 40, 50%. That 4 out of 5 Harlemites wanted to get a vaccine. The problem was it wasn't available. They didn't know how to register for it, or a variety of other reasons. So we've already seen some movement, so we can't say that all communities. But having said that, in our discussion during the Harlem Health Initiative, which is part of CUNY School of Public Health, and our discussion that we had with the community, with the borough president and others, we did speak about the barriers that exist, and the fact that just because we have that movement doesn't mean that we're going to be able to get the vaccination in place. So we really need to have equitable distribution and communicate over the challenges that have come from the past. And just as the aside, what comes up consistently are the Tuskegee experiments that were done with African Americans, unfortunately, last century. And rightfully so, we need to dispel those fears that this is safe and effective for everyone, regardless of color, background, and as of now, 16 and older population.
I saw there was a session at Bronx Community College for students, and one of the speakers there also made a point of, it isn't just the past, it's that there is racism going on right now that these communities are experiencing. So it's not just Henrietta, it's not just Tuskegee, it's right now. So I'm wondering if that comes up when you have your town halls or people express concerns like that.
Well, we are trying to deal with structural racism and actually try to integrate that in all of our courses and address the reality of what has happened, unfortunately, at this phase in American history. So we have what we call listening. We try to understand the sentiment, and we are really trying with Convince to remind people it's not just give the same information to everybody, and it's not just communicate as everybody is equal. From the health literacy side, so what people know about health and their ability to read or understand, or the cultural issues, but also that the system needs to simplify and make things in a way that people could understand and the way they like to hear it. They might want to hear it from their pastor, the clergy, or their rabbi, versus if they are going to hear it from their professor or mind you, from the television news reader. So we're trying to use multiple channels to get the right information and to address, as you say, the reality of how people feel about some of the religious and racist issues.
It wasn't easy. I did get vaccinated. It wasn't easy to get an appointment. And I really did it myself, but I always joke that. I told my son I was one step away from calling you, and it was hard for me. I mean, it really was very time consuming and certainly could only be done on the computer.
Mm-hmm.
So we have a lot of things going on here, I think. I want to talk to you a little bit about access. Are they
Sure.
rolling out more vaccines now? Are they going to come to the communities that need them? Are people going to find it easier to sign up? What do you see in terms of going on right now?
Well, unfortunately, I think what you mentioned is what we often call the digital divide. Although the digital divide, even access, everybody doesn't have a smartphone. Everybody doesn't have broadband or Wi-Fi with the speed that, renders us equal. So we need to address that. We can't do it all with digital literacy or that ability. Like many of our young people are, like you say, your son, just like my son, I would have help. So absolutely.
Almost called them.
Yeah. But what we also looked at in Harlem, which I think is quite interesting, is the assumption that you mentioned the Bronx, that, put everything at Yankee Stadium, people will want to go there and, it's free or whatever. Everybody should know the vaccine's free. But what we did find is that people don't want to go to sports stadiums, and they don't want to go to their church or their local religious site. They want to go where they're used to, and we found specifically more people wanted to go both to their hospital or their doctor's office, what we call a healthcare home, although others would like to go to their local pharmacy. And this breaks by, even in Harlem, the African-American community is more like the hospital and their doctor's office. The Latino or Latina community tends to like going to their pharmacy, but it also might be the location. But very few are waiting for that mobile van to come by or wanting to get on to travel to, whether it's the Bronx or the Yankee Stadium or the Javits Center. So we have to figure out how to get the vaccine so people can get vaccinated at the place where they feel comfortable.
Now, we know that CUNY wants to open soon and have face-to-face classes. I mean, I know they really would like to have that happen as soon as possible. Mm-hmm. What do you see as some of the barriers to doing that? And what would you like to see in place in terms of vaccination, if that is the key issue? What would help the university to open up with face-to-face instruction?
Well, first of all, we have to try to think about this in an equitable way. And there's been all sorts of discussion. Do you need to have a smartphone app that says you've got vaccinated or you tested negative? Well, that's a nice idea and that's aspirational, but we might need to have something in between, a paper card, or if not only that people are willing to sign some sort of pledge or something that they are able to still continue to practice the appropriate public health behavior, whether it's wearing a mask, social distancing, and so forth. So we've got to try to put a place that has a culture that if you go to school or university or wherever classroom, that there are certain criteria that need to be met. Now, in the Commonwealth of Massachusetts, to enroll last fall, you had to have a flu shot. Now, we don't have that in New York or New York City, but imagine we did say, just like you have to have a meningitis shot if you are enrolling as a full-time student in many places, that we have a condition of in-classroom instruction that you have to meet those criteria. I haven't set those criteria. I know they're probably under discussion. One, should we have the teachers or professors to have access and be able to get that? And what about when there are potential exemptions that are for medical purposes. So a lot of it has to be thought through, but I do think, and I do believe that we can have safe in-class instruction in the fall with the penetration of vaccines that will be likely to be between 60 to 80% in New York City by September.
Let's go
Okay.
to the variants. I was feeling pretty happy about being vaccinated. I was thinking I was, in pretty good shape. But now I'm not so sure that I am because I am concerned about the variants. How big a concern are they? Are they going to undermine our vaccination program? It is a reason some people give for not wanting to be vaccinated, may not work anyway. What do we know so far? And should we, I know we should get vaccinated regardless, but how big a threat are the variants, and what do you think about that?
Well, thank you, Linda, for first reminding that, yes, we should get vaccinated regardless. And similarly, when you get the annual flu shot, it's only effective maybe 40, 50% of the time, if that. But that's 40 to 50% fewer people getting sick who get the vaccine, right? So there are ways of extrapolating that appropriately. The point here is that, yes, the vaccine is helpful, and it should protect against the base virus, coronavirus or SARS-CoV-2, as we call, that causes COVID, and it will likely cover all the variants. However, if we continue to have wild type coronavirus still out there and we get more and more variants, so that's why we need to get as many people vaccinated, there is a chance that one of those would break through, in which case there are already some boosters or other vaccines already in place that will be able to cover that. So I would say, yes, the vaccines now appear, at least the 2-dose vaccines that have been approved by the FDA for emergency use authorization do cover the variants, but all of them don't. New ones might not cover them equally.
You are trying to convince people to take the vaccines. So tell us a little bit about some of the programs and things that Convince USA is doing to get people to overcome reluctance.
Well, thanks, Linda, for asking about how we've established Convince at CUNY School of Public Health. We are a research-based institution and database, but yet we also want to put this into practice at the community level. So we've been fortunate to actually have a study that we're doing with support of the CDC Foundation, Commonwealth Fund, and others to look at how to build trust in health services and helping people make vaccination decisions during this pandemic. So we're researching and having that inform our activities. We have come up with a term, the public health community, vaccine literacy. So it's giving people the knowledge and skills, but also to understand how the system is there to promote vaccination and give people the knowledge, help give trustworthy information, how to dispel facts and fears. And we're putting together activities to do that, whether it's communicating via traditional community methods, such as identifying a survey and then giving why those facts are something that we need to address. But also we have a business partners group to Convince that's working on worksite challenges so that everybody, if you work for, imagine everybody at CUNY or others, would be able to sign on to also pledging to listen to people's concerns, follow public health advice, get vaccinated when available, be able to share that information with others, participate in community activities, whether it's sports, other community pieces, religion, where you can also talk about how we want to get back to the world before we had COVID. And with that comes vaccine. And we think we could get there, and we will get there as a society, but we're not going to get there simply. So those are the things that we're working on. Convince is meant to be participatory. So it's open in that we have lots of groups are joining on. We're engaging our students to think about ways of using social media. We already created a continuing education piece for doctors and nurses and community workers. But we're working, we have a variety of other pieces that will be out there. Public health people can have a dashboard on a planning side. But we really would like to see this device as a health benefit rather than as a hazard. So I say that for those of you who text and walk across the street, don't do that. But if you get information about on COVID and how to prevent it, that's a good thing.
What do you think is the percentage of people we need to have vaccinated in order to come out of the other side of this?
Well, to follow the medical side or scientific side, we've used the term herd immunity. And the expectation is we need about 80%. Now, compare that to measles. Measles is 95%. So this is not as effective an agent as measles, but to get to 80%, and the two vaccines that have been approved, the first two with a double dose are about 95% effective. And if the third one that's been approved is only 80% effective, you need to get more than 80% of the population vaccinated. So we're looking at probably, 8 out of 10, I would say you almost have to say 9 out of 10 people of adult age or even over the age of 12 will have to be vaccinated to get to the herd immunity or community protection that we need. That is not an easy task.
It's a lot.
Yeah, we think that probably 30 to 50% of the population, once we get enough out there, will, I don't say easily, will get vaccinated as they expect to. They'll get on the clearing list as you did. You've been able to get through the clutter. Maybe you'll do it at the Rite Aid or wherever it might be. Maybe you will eventually have it at one of the CUNY sites, because I know some of them are starting to have that, not run by CUNY, but by the state appointing and so forth. But then we're going to have the hesitant or reluctant population, often called the wait and see. Right. And what are people waiting for? They're waiting to see if their friends got it, or are they waiting to see, if anybody's sick from it or what? But we think that wait and see group is going to be the next May, June, July. That's going to be a little bit more difficult. And that hopefully will get us to maybe 60, 70%. But to get to that final 80%, we're going to have to really family, friends, maybe have some incentives. And some of the incentives will be, I want to go to my sporting event. I want to get on the train. I want to travel. I want to enroll in classes. And that's okay. I believe that's ethically okay if we're able to provide it free of charge and easy and equitably. So hopefully we'll be able to promulgate that, together with both the media as these kind of shows. But we're doing podcasts, we're doing radio, we're putting as much stuff out there because people still get their information, not from social media, number one, maybe our young viewers, although they're viewers still. Most people are getting their information from TV and cable news across New York City. And our surveys show that time and time again.
I do have to say that I think the talk about side effects, I know that I even know some people who will get vaccinated, but they're a little put off by what they're hearing about side effects after the second vaccine. I myself had a reaction after the second vaccine. So can you talk a little bit about that so that people understand what the side effects mean and that you're not getting COVID? I really have had people who know better say,
Sure.
Really worried there for a minute, that I felt like I was really getting sick. What
Sure.
can you say to them to assure them that they are not getting sick? What do we know?
Sure. Well, first of all, some side effects are actual effects, right? It's not a surprise that you have pain where you had a shot. Now, what is appropriate pain? Is it there for a day? Is it there for a week? Does it become itchy? Does it become inflamed? That's a side effect, and that's okay if you get that. Some people have fever and chills and other pieces within the first, 12 to 36 hours, 8 to 36 hours. It goes away. It's self-limiting, and some medical folks believe that means you have a strong immune response, and likely to be the case. But that doesn't mean if you don't have the side effect, you don't have an immune response. So we have to be careful about explaining that. But those are side effects. I mean, other, fatigue and other pieces that come, headache, that's common and not anything to worry about necessarily. And about 1 in 8 people have some sort of side effect. But yet, what people have to remember is this is not a vaccine that is going to give you COVID. And that's the piece, that if you do have a vaccine and you do get a piece of paper afterwards that says it's okay to take a couple of Tylenol or acetaminophen or what have you, and if it's over a certain period of time and it doesn't seem to be so-called a normal side effect, then you need to seek medical care.
I'm a little curious, how does the US fare globally in terms of people being willing to take the vaccine?
Well, Linda, that's one thing that we've done at CUNY while we're the Public School of Public Health in New York City. We've also done a global survey, and we actually did this of 19 countries last summer in June, and we found that the United States was quote, in the middle of the 19 countries. There were about 74% of the American population was willing to say they would take a vaccine if it were safe and effective. China, on the other hand, is very high, goes with their culture. And frankly, a lot of Asian countries are much higher where they'll follow their government. The French, on the other hand, in our study, were much lower, around the 50 percentile range. And they consistently are also lower. So some of these are, you can speak about with culture, some you can think about it by government, also the way that the effectiveness may have been in the past for a variety of other health issues that may or not even been linked to vaccination. So it's quite involved of how you understand it. And one of our partners at the London School of Hygiene and Tropical Medicine, Heidi Larson, runs a vaccine confidence project, and she's part of our research project at CUNY School of Public Health. She measures sentiment, and she's just saying you have to listen. This is complex, but yet at the same time, we want to, at the end, after you understand, most people, when they hear the reasons like we're talking about now, they will say, yeah, yes, I want to get a vaccine. It's the right thing to do.
We're running out of time, but I have one last question that really I could use some help. When you come across somebody you know personally or at work, and they say to you, I'm not getting vaccinated yet, or I'm waiting, I don't trust it. What can we say to people that we run across who we know in terms of that conversation?
Sure. Why is that? Okay, what kind of data do you need? Well, it's been good enough data for whether you know Dr. Fauci or the doctor, your local doctor, or your local church, or wherever it might be. It has been good enough for lots of different people. So is that enough? Well, I still want to see the info. Well, if you go to this site or this group, or you want to listen to some things. So I think we have to try to listen and have the 2 or 3 questions of why. Okay. And then try to say, well, I got it, or look at the pictures that I have. And that's what we're trying to also foster, is people taking pictures of themselves or talking about the experience. Oh, it was a really bad side effect, but now I can go out to the restaurant with my friends next week. Or now I know that my daughter or son's wedding or whatever it might be. So those are the kind of things that we're trying to foster. And I think that would be the way to allay the fears, and also
I want to handle it better. I want to be better. I want to thank you so much for joining us today, Dr. Scott Ratzan from Convince USA at the CUNY School of Public Health. This is such an important conversation, and the work that you are doing is so important. So I thank you so much for taking the time to be with us today. Thank you so much.
Well, thank you very much. It was a real pleasure to be here.
Thank you to all of you for joining us today for this edition of EdCast. Here's hoping that 2021 is a better year for all of us. Thank you so much.
What are the alternatives to not taking this vaccine? The alternatives are the potential of getting a deadly virus that you could get it and you might be totally fine, but you could actually give it to your mother, your sister, your brother, your neighbor, your auntie, someone, your child, and they might not be fine.
And that's not something that I think anybody wants to live with, is being the person who transmitted to COVID to their parents and killed them.
Even if they don't die, but they're left without a limb, we've had people lose their arms, legs, fingers. They have a stroke and can no longer talk, walk, see. And it's all because you carried it to them and you had an opportunity to prevent it.
To hear from you, please send your thoughts and comments to cunyedcast@gmail.com.